I remember when I first started learning about Medicare, and let me tell you, it was overwhelming. But that's why I'm here today, to break it down for you, make it simple, and hopefully even a little fun. Now, before we dive in, I want to make something clear. We're not a government agency. We're here to provide you with information and entertainment. So are you ready to embark on this Medicare journey together? Now let's focus on the foundation of Medicare, Parts A and B. These are like the bread and butter of the whole system. Part A, that's your hospital insurance. It covers things like inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Now Part B, that's your medical insurance. It's got you covered for doctor visits, outpatient care, medical supplies, and preventive services. An important point to remember is that neither Part A nor Part B cover everything. For example, Part A won't cover medications you take home after a hospital stay, long-term nursing home care, or routine dental, vision, or hearing care. And while Part B covers a lot, it comes with a monthly premium that varies based on your income. Now let's dig a little deeper into Part A. I want you to understand what this part of Medicare really means for you. Part A is all about hospital insurance. It's like having a safety net for those big, unexpected health events. You're covered for inpatient hospital stays, which is huge. But it's not just about hospitals. Part A also covers care in a skilled nursing facility, hospice care, and even some home health care. But it's crucial to understand. Part A has its limits. It's not going to cover everything related to a hospital stay. For example, if you need to take medications home after your stay, that's on you. And if you need long-term care in a nursing home, Part A won't cover that either. Understanding these gaps is essential so you can plan accordingly. Moving on to Part B, your medical insurance. This is where a lot of your day-to-day health needs come into play. Part B covers things like doctor visits, outpatient services, and preventive care. It's also got you covered for mental health care, some medical equipment, and even ambulance services. But here's something you need to keep in mind. Part B isn't free. There's a monthly premium, and it varies based on your income. For most folks, it's automatically deducted from their Social Security benefits. But don't worry, we'll explore more about costs and how to manage them later on. Now let's explore Medicare Advantage, also known as Part C. This is where things get interesting. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They bundle your Part A and Part B coverage, and often include extra benefits like dental, vision, and even gym memberships. But there's always a catch, right? With Medicare Advantage, you're usually limited to a network of doctors and hospitals. It's kind of like joining a club. You get lots of perks, but you have to play by their rules. Consider this carefully if you have specific doctors or travel often. Let's move on to Medigap, also called Medicare Supplement Insurance. Now, this is different from Medicare Advantage. Medigap is designed to fill in the gaps left by original Medicare. It helps cover things like co-payments, co-insurance, and deductibles. One of the great things about Medigap is its flexibility. You can see any doctor or hospital that accepts Medicare anywhere in the country. No networks to worry about, and your out-of-pocket costs are more predictable. But remember, Medigap policies don't cover everything. They won't help with certain types of care and services. These include long-term care, vision or dental care, hearing aids, eyeglasses, or private duty nursing. Now I want to highlight some common Medicare mistakes I've seen people make. The first big one is choosing the wrong type of Medicare coverage. It's important to understand the difference between original Medicare, Medicare Advantage, and Medigap. The second mistake is choosing the wrong plan or insurance company. Not all plans are created equal, and what works for your neighbor might not work for you. It's important to compare plans carefully, looking at things like cost, coverage, and network of providers. Don't be afraid to ask questions and seek help if you need it. Remember, this is your health we're talking about. It's worth taking the time to get it right. Let's discuss enrollment. Timing is everything when it comes to Medicare. Most people are eligible when they turn 65, and there's a 7-month window around your 65th birthday to enroll. If you miss this initial enrollment period, you might have to pay penalties later on. It's like missing the early bird special. You end up paying more in the long run. To enroll in Medicare Parts A and B, you'll need to go through Social Security. You can do this online at socialsecurity.gov, or visit your local Social Security office. If you're already receiving Social Security benefits, you'll be automatically enrolled in Parts A and B. But if you want a Medicare Advantage or Medigap plan, you'll need to shop for those separately. Remember, enrolling in Medicare is an important step. Take your time, do your research, and don't hesitate to ask for help if you need it. So where do you go from here? Well, I've got good news for you. We're offering a free healthcare consultation to help you navigate your Medicare options. It's like having a personal guide to help you through this journey. During this consultation, you can ask questions, get personalized advice, and really understand what Medicare options might work best for you. This is your chance to get clarity on any confusing aspects we've discussed today. We've covered a lot of ground today, from the basics of Medicare Parts A and B to the ins and outs of Medicare Advantage and Medigap. Remember, choosing the right Medicare coverage is a personal decision. It depends on your health needs, your budget, and your preferences. There's no one-size-fits-all solution. Take your time, consider your options carefully, and don't hesitate to seek help if you need it. I want to thank you for joining me on this Medicare journey. Remember, we're here to help you every step of the way. To schedule your free healthcare consultation, just click the link below this video. Thanks for watching, and I'll see you soon.